on?
Oh,
Oh,
push,
you gotta
push.
turn the switch.
I'm sorry.
That's okay.
This on the bottom. Turn it.
No,
Okay.
there's a little switch on the, on where your hand is, on the handle.
Is it this? Oh, I'm looking at this thing.
Yep.
Sorry. Hello. I will be addressing fellow partners of New York State Partners in Policymaking, and I want to thank you for giving me this opportunity to speak to you today. My name is Arlene Reith. I'm a parent-family advocate at Stony Brook University Hospital Pediatrics, a patient safety advocate with Pulse of New York, and I also serve on the Long Island Patient Safety Advisory Council. Most important of all, I am the mother of 8 children ranging in ages from 32 to 15 years old. Our last 2 children, Gabriel and Sarah, were born with Down syndrome and were later diagnosed with autism. April 2003, on his 9th birthday, Gabriel was diagnosed with ALL leukemia. Gabriel died in the hospital on August 31st, 2007 from a systemic infection, also known as sepsis. I am here today to speak to you about patient safety, medical error, and children with intellectual developmental disabilities in a hospital setting. Please note at times I will be using the letters IDD for intellectually developmentally disabled. As an advocate for patient safety for the intellectually developmentally disabled, I'm very passionate about patient safety and patient and family-centered care for individuals with IDD, especially patients diagnosed with autism who are nonverbal. These patients become most vulnerable for medical error. In 2009, over 98,000 deaths were reported and caused by medical error in the U.S. hospitals. According to the Centers for Disease Control and Prevention, nearly 2 million patients develop infections while being treated in the hospital every year, and almost 100,000 of them die from hospital infection. However, as more hospitals engage in patient safety, risks are reduced and the statistics for death due to medical error are decreasing. Patient and family-centered care was introduced in 2007 at IHI, Institute for Healthcare Improvement, and in October of 2007, it was introduced at Stony Brook University Hospital. Patient and family-centered care produces beneficial partnerships among healthcare patients, families, and their healthcare providers. This innovative approach gives the patient a voice in their healthcare. However, the majority of patients with intellectual developmental disabilities do not have a voice, nor can they comprehend the definition and medical roadmap involving the treatment and care for their illness. Healthcare disparities faced by individuals with IDD are on the rise due to an increase in children being diagnosed with autism. I just heard this yesterday, that 800,000 children with autism will enter into adulthood within the next 10 years. Increased life expectancy of individuals with IDD due to improved medical and assistive technologies have enabled those with complex medical conditions to reach adulthood and old age. A major concern is the shortage of qualified, trained healthcare professionals with in-depth knowledge of the specialized health and mental health care needs of individuals with IDD. Parents, family members, and legal guardians need to learn how to advocate for their loved one with IDD when they are in the hospital. Healthcare providers and clinical staff need to be educated and trained concerning the effects of autism and other intellectual developmental disorders, most importantly sensory and behavioral disorders. Such disorders place the patient with IDD or the healthcare providers, including the clinical staff, at a high risk of injury, which increases the risk of medical error. Our son Gabriel had a dysfunctional overactive sensory system and was sensitive to textures, movements, and loud sounds, which caused him to respond with such behaviors as grabbing, pulling on his port in his upper chest, even to ripping the port out of his upper chest, yelling, throwing food, and possible seizure occurrences. He would become self-injurious or aggressive, just in an attempt to communicate he was in pain. I am passionate about my mission to teach parents and family members how to give their child of any age with intellectual developmental disabilities a voice in their health care. The Joint Commission, together with the Centers for Medicare and Medicaid Services, launched a national campaign to urge patients to take a role in preventing healthcare errors by becoming active, involved, and informed participants on the healthcare team. I earnestly seek the support of our legislators, fellow PIP partners, New York State OPWDD, special education teachers, service providers, service coordinators, and most important of all, parents, families, and legal guardians of all ages, legal guardians of children of all ages with cognitive impairments due to IDD to join me in helping to accomplish this important mission. To educate will mean to communicate, and when we can communicate, we can advocate. I will be available to answer any questions you may have concerning patient and family-centered care advocacy training and how you can become more involved, and I thank you very much.